Ozempic and other GLP-1 medications have dominated the healthcare headlines in recent years for their effectiveness in managing diabetes and helping people lose weight. In fact, roughly 1 in every 8 adults in the US reports having used one of these medications at some point. Now, there's talk of using GLP-1s for the treatment of substance use disorders. Joining us to share his expertise is Dr. Gary Malone, Medical Director at Greenhouse Treatment Center. Board certified in general and addiction psychiatry, Dr. Malone has been named one of the best doctors in Texas for 14 consecutive years by Texas Monthly. He's also a senior teaching analyst at the Dallas Psychoanalytic Institute and an adjunct associate professor at UT Southwestern. Expert Insights starts now.
Dr. Malone, I'm so excited to have you here to discuss this hot topic because we've been hearing a lot in the news about drugs like Ozempic holding the potential to be used for addiction. And with you being an addiction expert at our Greenhouse Treatment Center, I know you have a lot of insights and thoughts around this. So first of all, thank you for joining us on Addiction Talk Expert Insights.
Well, thanks for asking me. I'm very happy to talk about this subject. I hear about it. People ask me about it every day.
Really? It's becoming that common?
Well, it's in the news media, and in fact, patients hear about it. They're always wanting a new fix that might work better than the old fixes, and so it's in the news. It's topical. It's reported. I saw a report on CNN, on NBC News, on NPR about the fact that people on Ozempic testimonially reporting, just not studied, testimonially reporting that it's helping them. Testimonial means I testify that I took Ozempic and my cravings for alcohol went down. Which, by the way, leads us to they studied it in mice and rats and showed that their cravings dropped. It's not been studied in human beings and not scheduled to be studied in human beings by any of these companies, which is actually an interesting subject.
Mm-hmm. So when you think about this, how did we get to the point of even looking at Ozempic or other drugs and Wegovy and Mounjaro? I know they have a variety of different brand names. How did we even get to the point of saying, could this
work? I think they had just reports from patients, and really, I know many people that take Ozempic. And the way Ozempic works is that when your stomach gets full, it releases basically a glutamide type compound, and semaglutide mimics that, goes to your satiety centers, your pleasure centers, your brain, and tells you you're full. Now, the same pleasure centers are connected with addictions. They're connected with all your drives. Now, and actually, this is absolutely true. I've studied Ozempic and semaglutide more than most people. If you take semaglutide at a dose high enough to cause you to lose weight, you lose your appetite for food. You lose, very often, your desire to have sex. You lose your desire for alcohol. You lose most of your drives and pleasures, which is at some risk, by the way. And so the reports in humans are all simply incidental reports. People say this happens. The companies who make this aren't even willing to attempt to study it. There's no controlled clinical trials planned because the side effects of semaglutide are so severe that it probably in no way, the cost benefit doesn't work out to use it as a drug for addictions.
Tell me about this. I think a lot.
What?
Go ahead. You were going to say something?
The side effects. Say you're not overweight and you just want to stop drinking or using, say, opiates or using any substance, and you take Ozempic for it. Your blood sugar drops. You lose weight. Maybe you don't want to lose weight. It's a high probability you'll lose romantic interest in your spouse. Any problems there?
Yeah.
You can also get pancreatitis. It's very common. get stomach problems, get abdominal cramping, get liver damage, and you can get cysts on your pancreas. Pancreatic cysts are very common. So this is a cost benefit. This is a huge cost. If you are morbidly obese and have diabetes, these costs actually are worth the benefit of losing weight and getting your diabetes under control. And the comparison I would make to you is that we, in fact, have several substances we use, naltrexone and also Campril, which are known clinical trials to be effective in lowering cravings and stopping the effect of opiates and alcohol when you use them. You get less pleasure. They go to the pleasure centers and block them. And they do not cause pancreatitis or liver problems, or abdominal cramping, or low blood sugar, or unwanted weight loss. And the problem we have is that people, even other doctors, are not aware of what addiction psychiatrists do. It's part of our efforts like this show to educate people. Campril works primarily on alcohol. You have to take it 3 times a day. It makes some people nauseated. Naltrexone is stronger. The one study that actually has the most usefulness, they showed it in clinical trials. Naltrexone has been studied. 40% of people who take naltrexone will report a lower craving for either opiates or alcohol, and they do not feel the effects of the alcohol or the opiates. In one study in England where they do not do the kind of treatment we do here, they took a large group of people, and they don't do talk therapy there. They gave half of them sugar pills and half of them naltrexone. A year, 10% more of the naltrexone group were actually sober with no treatment. So the point of that, we have naltrexone, also the shot Vivitrol, which is expensive. But say the American Addiction Center, we give every patient either naltrexone or Campril because it improves your odds of the patient being sober a year in combination with a more comprehensive treatment program. They do not get sick to their stomach. They don't have stomach cramps. They don't have liver damage. Many of them already have liver damage from the drinking. They do not get pancreatitis, which is bizarrely crazy, or they don't get pancreatic cysts, which sometimes requires surgical intervention. I've known several patients who were taking the semaglutide products and had to get surgical interventions for their pancreatic cysts. So when you compare them side by side with the 3 main medicines we use, Vivitrol is a shot, which is naltrexone shot, naltrexone, which is taken straight up, is for opiates and alcohol, or Campril just for alcohol. These all work. They're FDA approved, tested in human beings without the side effect profile. So I think I have a strong feeling why this stuff is popular is because as most people who either have chemical dependency or know people have chemical dependency, is recovery is hard. It is hard. It's mind, body, spirit. We have to get all the poisons out, get you on safe medicines, talk about your emotional life, your spiritual life, reconstruct your life. It is a 1-year trek to get sober. The wish is always for something that makes it simpler. And I think that's where it's coming from. The scientific logic, quite honestly, doesn't make a lot of sense to me that you would ever prescribe a semaglutide product instead of one of our known products or instead of a traditional treatment program with the idea it's going to make people stop using drugs and alcohol. And then plus, if you did not do a treatment program, this is something else to say. Because there have been treatments that have simply made you stop drinking. There's the aversion therapy, you may remember, where if you like to drink, they give you your product you like to drink. And then when you drink it, you threw up. Then they make you drink your vomit, and then you threw up again. If you did that for 2 weeks, you couldn't drink for a year. You did no emotional work, no spiritual work, no lifestyle changes. And they had an 85% relapse rate in 1 year. So say your only treatment is taking semaglutide and you don't drink while you're taking it, you can, and if you were normal weight, you weigh say 180 pounds and you lose down to 140, so you have to stop, then your cravings come back and you're not done any emotional work.
I didn't even think about that. You bring up a really good point, Dr. Malone. The fact that once people lost so much weight on the drug, they couldn't stay on it, right? Because it would either, with your blood sugar dropping at a certain point, or you having, as you said, losing so much weight, it couldn't be a long-term solution. Where sometimes with some of these other medications, people can stay on them longer.
Oh, yes, you could take Vivitrol, the 1 month shot, naltrexone, or Camprol indefinitely. We set up at the greenhouse in the American Addiction Center a 1 year treatment program, because if you're sober for 1 year and you do all the changes you need to make, your the firing of your pleasure centers craving the drugs and alcohol starts to drop. It does not quit, it just starts to drop. So the program is for 1 year. I have people have been taking Camprol and naltrexone for 10 years because it is costless. You don't get sick, it doesn't cost very much money, and you stay sober. And people who get sober value their sobriety. They see the value in continuing to do the treatment that works. And for me, I always welcome new treatments. I saw a person this week who said he's going to go down to Mexico and take an IV hallucinogen, which has made people stop wanting to drink. He has a whole myriad of problems. He has abuse issues, has stressful lifestyle, has self-esteem issues, a defective sense of self. He has what I think is a pretty significant mood disorder, including depression and anxiety. Even if this stuff does work, which I doubt, all these other things are going to come back because his drinking actually helped cover over these symptoms he doesn't want to deal with.
Mhm.
And so it gets back to what is the correct answer here? We have effective treatment, not just in our centers, American Addiction Centers, that in practice in the United States. We have the most effective type of recovery programs for drugs and alcohol. And it includes using craving medicines, medicines to fix mood disorders. We help resolve people's internal conflicts. We help them look at their defective coping mechanism style and construct a sober lifestyle, which includes exercise, meditation, spiritual growth. That's what works the best.
So do you think, like you said, we're looking for some miracle drug? Do you think that is giving people a false sense of hope that one day we'll have like this miracle drug for addiction? Or do you think it's possible, like we're on the brink of something in the future? Or do you think, as you said, this is a multifaceted disease, and even if you deal with the cravings, you have to deal with the other components?
It's biopsychosocial. So even we make the cravings go away, you still have the other components there. You have defective sense of self, unresolved past issues, maybe trauma issues. People have codependency, they overwork, caretake others, don't take care of themselves. I started medical school 1975, been a psychiatrist since 1979. Everyone comes to see me is go, oh, Dr. Malone, okay, you have the fix. Give me the fix. You have a magic wand in that drawer, don't you? If you ding it on my head, everything will give me all better. And what I always tell them, if I had a magic wand, I'd ding myself first, and any juice left, I'd ding them. But anyone knows who's been through any kind of treatment that it's emotional work. Emotional work where you have to bear things that are hard to bear, and you speak things that you don't want to say. And then you have to change the way your life is structured. And that there, I would welcome a magic fix. Now, I have referred people down to Mexico and to Central America who have intractable addictions, or mainly who have closed-head injury, or they're war veterans who cannot stop their nightmares or EMDRs or their medications. It helps a low percentage, not a miracle.
Mhm.
Maybe
So
somewhere in the range of 25-30% with some relief.
well, let me ask you this. Why is it that if you just deal with the cravings and you don't deal with the other part, what will happen? Will the person still eventually go back to the alcohol or drugs because they don't have the craving anymore? So my thought process would be that they wouldn't go back.
Well, okay, so the study in England tells us that because they don't do therapy there. They don't do therapy, they don't prescribe medicines. 10% are able to stop just because drugs and alcohol don't feel well, and they're able then to, through introspection or some other ways in their life, reconstruct their life to do it. That's not a high number. is, we're realistically, if you simply stop craving, the other factors that led you to the addiction are still present. They must be dealt with in some way. The most effective way is to go and talk to a therapist and go to groups, go to AA, go to group therapy, find some fellowship and some closeness. We talk about spiritual growth. That's not any particular religious base. You just have to find a way to obtain some self love and to love yourself. Without self love, no love to give. You cannot pour from an empty vessel. This is all just basic therapy.
Mhm.
And so just taking the cravings away, the person's still not in great shape unless you do other therapies,
Mhm.
unless you
So
do
do
other
you
therapies
find
to help them with the.
No, I think what you're saying is really interesting because I'm wondering then if they don't deal with the other parts, do they tend to turn to another coping mechanism? Is that what you find?
Oh, if you cannot bear what's inside your head, you'll find a way to avoid it. I
Mm,
see people all the time who've lost all their money gambling. If anyone who's listened to this ever been to a casino, it feels good to be at a casino, and it's fun, and it's exciting, and inevitably, the way the math works, if you can stay in the casino long enough, you will have zero assets. That's just a math issue. Or people who become sex addicts, or people who become thrill seekers. I've known people who jumped out of airplanes or jumped off cliffs with skin suits, and about 46% of those people wind up dead, trying
mm,
to find some thrill to get away from how they feel. And
mm,
the heart of our therapy is now, as it's always been, is to get at peace with yourself, emotional peace, spiritual peace. You have to go through your own history and resolve the conflicts that have caused you to be self-destructive in the first place. The unfun but necessary thing and extremely satisfying thing about our work. So, if we had some magic way to take away the cravings, that person would still have to deal with the other factors that drove them to the addiction in the first place. And by the way, if I had a pill that would take away all the cravings, I would give it to them. Actually, naltrexone works pretty well, by the way.
mhm.
But you'd still, even though I have people on naltrexone or Camprol, they still have to come talk to me. Now,
And I
another
know
thing to point in, go ahead.
Go ahead. Go ahead. I'm sorry. I didn't mean to interrupt you
I was going
there.
to say the other medicine we use is antabuse. We use antabuse, but that's the throw up drug. That's the negative reinforcement. If you drink, you puke your toenails out. It is the least effective treatment because people won't take it. They won't take the pills. So it has to be a multi-dimensional treatment program to ensure the best possible outcome.
Mhm. And I know previously we had talked about this, and you said something very interesting that you've had people who came to treatment who were on some of these, semi-glutide medications, and it wasn't enough. I mean, you've seen that just firsthand at Greenhouse Treatment Center.
Oh, my caseload right now, I have probably 10 people taking semaglutide products. They still came in and they had to be detoxed from opiates or from benzodiazepines or from alcohol. It is not a cure-all. They're taking it for diabetes or for morbid obesity. Um, and it's just the wish that they found the silver bullet. They found Fleming discovering penicillin to cure bacterial pneumonia. Of course, now the bacterial pneumonia is adjusted to penicillin. It doesn't work anymore. You have to use other things. But the diseases are there. You have to have an approach that gives you the best percentage outcome. We do the best. We set a program, give people the best statistical chance to be sober at 1 year.
Mhm.
That's what we set up for people. That's what we recommend, and we set up the entire program for a year when people come to see us.
Mhm. Question for you as we kind of wrap this up. With the people who came in anecdotally that were on these semaglutide medications, GLP-1s, did they have less severe disease? Did it have any impact?
No, because you got to realize this is not even a naturalistic study. This is testimonial evidence. People are saying, "Hey, I took this medicine and I want to use less." There's been no double-blind study to test this. The people I see come in, the 10 people on semaglutide, they came in with a rip-roaring addictive illness, and I had to detox them off heavy doses of either alcohol or opiates or benzodiazepines. Semaglutide had no impact on the illness, zero impact. So, and that's my testimonial evidence, but we see people with a more severe illness here. So if it does help, it's just some. Well, let me give you something else. Naltrexone is pretty effective for weight loss. Did you know that?
I was going to ask you about that, because I was saying, is the converse true? Since we have all these other medications that we're using for addiction, why haven't they ever been looked at for weight loss?
They have. Naltrexone helps with weight loss. It doesn't affect your sex drive. Naltrexone, I've seen, we use it at the psychiatric hospital to stop people from self-injuring, from cutting themselves. Because if you cut yourself, you get an intense reaction. Naltrexone will stop that. But naltrexone has been used for a very long time for weight loss. It's an additive for weight loss. It's not curative, but it's additive. So they're all hitting the same pleasure center in your brain, same part of your brain. And
so people can get they could go to a doctor and get naltrexone like that. I had never heard that before. That's really interesting to me.
It helps some. It helps some. It's an additive. Remember the 10% number from England. Standalone helps some. But if somebody is overweight and you're not taking semaglutide, you have to work at controlling your diet and work the emotional factors that maybe cause you to overeat. It is hard work. The most effective program for weight loss is still Weight Watchers, which you have to go to meetings all the time and record what you eat. It's work. It's work every single day. So, but the medicines are adjuncts. They're not cure-alls.
I think that's the biggest message here tonight, that medications are adjuncts. They're not cure-alls. And when it comes to addiction, like you said, it's so many different components that you have to deal with. And what you've seen, as you said, and I think this is a really good message for us to end on, and maybe you can hit this home, that people who go through a year long, they have the greatest success, a year long worth of treatment, even if that's like inpatient, outpatient, along the way, have the best success. Is that what you see long term?
Exactly right. It's like I used to work at the Sammons Cancer Center doing cancer work. What the people want is the strategy gives them the best possibility to be cancer free. And we give the best possibility to be drug and alcohol free. If you're going to use a medicine that's is something that's an adjunctive medicine, use one with the least side effects and the most effective. We already have those that are FDA approved. They've been tested, double-blind studies approved by the FDA to be given for cravings and for addiction. Not something that just gets some testimonial evidence that's not been tested, that has all these side effects, that not a single person comes to me and goes, "Hey, can you make my stomach hurt my liver, give me pancreatic cyst and pancreatitis, please, and lower my blood sugar?" No one comes and says, "Please give me that." But those are all the side effects of semaglutide products that do not occur with the other products that we have to offer. And those other products are part of the whole program of giving people their best chance to be sober 1 year, reconstruct their lives with their family, live to be old people. That's the whole point of this.
Well, you've given us a lot to think about, Dr. Malone. I really appreciate you joining us on Addiction Talk Expert Insights, and hopefully we'll have you back again to talk about another interesting topic, because you've really broken it down for us. And I think people will walk away from this really causing them to think and to really look at the research, because what we're doing is already working and there's already these drugs out there, but it also, as you said, is a multifaceted approach. So thank you again for joining us and giving us so much wisdom.
Joy, thank you so much for having me. I enjoyed this talk.